Welcome to the instructional video for the Rusch MMG H20 Hydrophilic Intermittent Catheter Close System from Teleflex. Information in this video is not intended to be a substitute for the advice of a qualified medical professional. You should always consult the advice of your physician or other healthcare provider before using any product. Intermittent catheters are prescription only and single-use only. Do not reuse. The Rusch MMG H20 is a hydrophilic intermittent catheter in a 1,300 milliliter collection bag for bladder drainage, and is designed to help reduce the risk of urinary tract infections. Some of the features of the Rusch MMG H20 include a thumb hole for easy handling, a pre-perforated bag that tears easily for emptying, an integrated 0.9% saline pouch for convenient hydration of the hydrophilic catheter, a protective cap with a ring for easy removal, and an introducer tip that assists the catheter to bypass bacteria to help reduce the risk of urinary tract infections. For catheterization, you will need an MMG H20 closed system, antiseptic for cleansing the urethral opening or meatus, and if needed, the freehand device from Teleflex. After gathering all the supplies needed, wash your hands thoroughly before performing your catheterization. Having clean hands is one of the best ways to help reduce the risk of infection. Position yourself for catheterization. Using the freehand catheter, hook the top of your pants, pulling them down, and then securing the other end of the device under your chair. Use an antiseptic to cleanse the urethral opening or meatus. Next, burst the saline pouch in the collection bag either by pressing down on it in the direction of the arrows or by folding and squeezing it. Gently rock the catheter collection bag back and forth for approximately 30 seconds to make sure the saline solution wets the entire catheter and thoroughly activates the hydrophilic coating. If right-handed, using your left hand, insert your thumb into the hole in the bag. Then use your thumb and index finger to grasp the guide grip inside the bag. Remove the protective cap to expose the introducer tip. The introducer tip is one of the main features of the MMG H20 closed system for helping to reduce the risk of infection. The introducer tip protects the catheter, allowing it to bypass the first 1.5 centimeters inside the urethra, where the majority of the bacteria reside. Therefore, it is very important that the introducer tip is inserted into the urethra the full 1.5 centimeters before you start advancing the catheter. Hold your penis in your right hand. Advance the introducer tip into the urethra using your left hand while holding the guide grip with your thumb and index finger. Advance the catheter through the urethra at 1 to 2 inch intervals. After each push, squeeze the guide and stabilize the catheter. Then straighten the bag with your right hand. Continue advancing the catheter until urine begins to flow. After urine stops flowing, gently remove the catheter with the bag attached. Tear down into the bag at the perforation and pour the urine into the toilet. Dispose of in a proper trash receptacle. Finally, wash your hands again. Thank you for choosing Rusch brand urology products from Teleflex. For further product support, please call our helpline at 800-334-4475 or visit our website at www.teleflex.com.